Tramadol, a potent synthetic opioid, has been widely used to treat moderate to severe pain, but a new study suggests that the medication's potential risks outweigh its limited benefits for chronic pain, and that the use of it should be minimized. Common opioid is not that effective for easing chronic pain. Study finds tramadol, a potent synthetic opioid, has been widely used to treat moderate to severe pain, but a new study suggests that the medication's potential risks outweigh its limited benefits for chronic pain and that the use of it should be minimized. The study, published Tuesday in the journal BMJ Evidence-Based Medicine, found that tramadol may have a slight effect on reducing chronic pain, but there appears to be low evidence. The findings indicate that the benefits of tramadol are questionable or, at the very least, uncertain. Furthermore, evidence suggests the presence of potentially harmful effects. Dr. Janus Jacobsen, lead author of the study and a clinical professor at the University of Southern Denmark in Copenhagen, said in an email. Tramadol can have serious side effects, including cardiac events such as chest pain, heart disease, or congestive heart failure, according to the study. Therefore, alternative treatment options should be considered before prescribing tramadol, Jacobsen said. Patients are advised to consult their physicians to determine the most appropriate treatment for their condition. Such treatments should likely be individualized according to the type of chronic pain experienced. Additionally, opioids as a class of drugs can be addictive. It's estimated that about 60 million people worldwide experience the addictive effects of opioids, and tramadol is often considered safer than other opioids. Potential harms versus benefits. According to manufacturer records, the new study says nearly 12 million daily doses of tramadol were consumed worldwide from 1990 to 2009. The study, conducted by a research team in Denmark, included an analysis of 19 separate clinical trials that evaluated tramadol versus a placebo in treating various types of chronic pain. The trials were published between 1998 and 2024, and collectively, they involved more than 6,500 people, ages 47 to 69. Some of the trials included in the study were related to osteoarthritis, diabetic nerve pain, and chronic low back pain. To our knowledge, this is the first systematic review related to the usage of tramadol for any type of chronic pain with a thorough investigation of adverse events, the researchers wrote in the study. Their analysis found that tramadol increased the risk of both non-serious and serious adverse events, including nausea, dizziness, constipation, drowsiness, cardiac problems, and neoplasm events, which are an abnormal and excessive growth of cells and tissue that can form tumors. These neoplasm growths can be either benign or cancerous. The researchers also found that there was low certainty evidence that tramadol may reduce the intensity of chronic pain below a certain level that they called the minimal important difference threshold. Typically, pain intensity is measured using a visual or numerical scale, such as when patients are asked to rate their pain on a scale from 0 to 10, with 10 being unbearable pain, Jacobsen said. But since each person may have a difference in pain perception, the researchers used a minimal threshold to evaluate a clinical difference in tramadol's ability to reduce pain versus a placebo, based on the clinical trials they evaluated. Although statistical analyses may reveal differences in pain scores between patients, these differences may be so small that they are not perceptible to the patients themselves, Jacobsen said. Therefore, it is crucial to predefine a minimal clinically important difference when assessing pain levels to ensure that the results reflect changes that are meaningful to patients. In the new study, the researchers chose a minimal important diffie